The old model of food bank distribution relied on loose cans and boxes of shelf-stable food that came in, and we were entirely at the mercy of what people chose to donate. But it's not just a quantity issue, it's a quality issue. We want to feed them, but we want to feed them the healthiest, most nutritious mix of food we can. We get now nutritious food from all perishable departments and stores. People who are struggling with poverty or families in need really aren't dealing with one challenge at a time. So why should we, as those providing the solutions, pretend that we can hand somebody a bag of food and say, here, all of your family's problems are solved with this bag of food? Two, we ought to focus on first, to change the nature of the dialogue in this community and get people to focus on these issues differently, was that convergence of hunger and health.
When we focus on nutrition, we can make sure that the people we're serving are not just fed, but they're nourished, and that way they can thrive and they can really live a healthy and productive life. Cooking Matters, I would say, is one of our biggest nutrition education programs. So that is in partnership with Indie Hunger Network. Our participants report they've lost a few pounds as a result of the class, their blood sugars are in better control. That to me is proof that the team effort going into it is worth it and that it's working and effective.
Premium Produce Patch came about really as a result of Gleaners operating a produce distribution cooperative in this building. Our team here really wanted to make sure that every single agency that is a Gleaners partner has access to this produce.
The need became so great at our food pantry that they needed someone to pick up the extra slack on the alternate days, on Wednesdays or Fridays, and that's kind of how I got started. I mean, they're driving an hour and a half and 2 hours from the edges of the state just to come to Gleaners so they can help feed the needs in their community. Filling that gap alone, you can only imagine what that would do for the health of them and those that they're caring for. After a typical Thursday when 50 or 60 families go through, it's all gone in one day.
About $1,800 per year is spent by the families who can't access even healthy foods for their family. They spend more money on healthcare than the average family. We thought this was the best place for us to work with because of our shared values.
So here at PCAR we have traditional medical appointments, but with that we know that there's a lot of other issues that play into a person's health. A lot of these, what we would call social determinants of health, and we work to provide those other services to help people meet all of their needs here when they come for a clinic appointment. We were able to partner in the community with St. Luke's Methodist Church, Dow Agro, and Gleaners, and that's how our Crooked Creek Food Pantry was born. And then in 2017, we had the opportunity to partner with Indie Urban Acres, who have started to farm the front part of our property in order to bring in even more fresh produce available for our families in our food pantry. We see a link between food insecurity, food deserts, and even intermittent hunger with actually having childhood obesity. We want to give people the opportunity to be able to eat things that we know will help them live a longer and healthier life.
We really wanted to make an impact up here, a little bit more than what we already have been doing. Having this space centrally located with a lot of different services is the perfect recipe for a collaborative effort. So we have Ivy Tech students, some of their students volunteering with us and shopping with us, and we have some of their teachers coming to volunteer as well.
You take the food deserts and you take crime and you kind of overlay those maps, and gives you a better idea of where we can have the most impact and where the most need may be. Hunger and poverty sometimes lead to poor choices. We want to be helpful and preventive along with Gleaners in getting out in front of that. This is also an opportunity for people to humanize police officers. We've gotten away from that a little bit, and this is an opportunity to kind of bring that back.
I don't think people realize how huge what it is that they're doing for the community. The need is immense. It's way more than you realize.
Food is medicine. The more fresh produce we can have to put with some of the other packaged items that we might have, the better our clients are going to be in terms of health.
We have to continue to think about how can we serve our communities and do it in a way that's different, that meets the need that hasn't been met before.
You know, we don't always think this way as police officers. Going in and taking care of the problem, we're trying to get better at understanding what those underlying problems are.
This mom, she was pregnant, had 2 small boys. They were homeless, sleeping on the floor at someone's house, and they hadn't had food for almost 2 days. They were hungry. It makes me extremely grateful for the partnership with Gleaners.
No one of us can solve it alone. I think it really requires a lot of collaboration and innovation. 2
years ago, 4% of the food that was leaving the Gleaners building was fresh produce. We're approaching 1/3 today in less than 2 years. Let's take people out of that food line, that unemployment line, that incomplete education line, however we need to. In partnership, done together, everybody contributing, everybody has a role they can play.